I'm Laura Levitt, the Director of Research Analysis and Publications at the American Society of Clinical Oncology within the Center for Research and Analytics. And I'm going to be presenting today with my colleague Heidi Kleppen from Wake Forest School of Medicine about efforts to improve the evidence base for treating older adults with cancer. And before I get into the meat of my presentation, I just wanted to say I do not have any conflicts of interest to disclose. So overall, the goal of all of ASCO's work and the other organizations that have been involved has been to improve the evidence base for treating older adults with cancer, with the ultimate aim that the more robust evidence will improve the quality of care received by older adults with cancer. So this slide shows the timeline of the work that we'll be covering in our presentation today. The work started in 2013 with an Institute of Medicine report, now part of the National Academies of Medicine, that found that the lack of older adults participating in clinical trials was a major quality of care issue for cancer. This led to ASCO to take up the issue, and ASCO issued a research statement in 2015, which led to a partnership with the FDA on this issue, which culminated into a public symposium. FDA then issued a guidance, and then here we are in 2021 with another public workshop at the National Academies of Science, Engineering, and Medicine. And then I wanted to note that parallel to the work at ASCO targeted on older adults, there's also been another initiative looking at how we could broaden the eligibility criteria in clinical trials, with the first set of recommendations coming out in 2017, and a second set of recommendations in press now and coming out later this year, which also have implications for how older adults are able to participate in trials. So, as I said, in 2013, there was an Institute of Medicine report delivering high-quality cancer care, charting a new course for a system in crisis. The report found that the number of cancer cases is on the rise. The majority of these cases are occurring in older adults, but older adults at the same time are underrepresented in research. This means that clinicians are extrapolating from research results in younger, healthier patients to treat their patient populations. It also found that there's a projected shortage of healthcare providers with expertise in geriatrics, and the report made a set of recommendations to address both of these issues, so improving the evidence base and strengthening our national workforce that cares for older adults with cancer. So most relevant to today's workshop, there's two IOM recommendations targeted at improving the evidence base of older adults. One, increase the breadth of collected data by matching the characteristics of the study population to that of the patients with the disease. So we really want to enroll more older adults onto trials. And then the second recommendation targeted the need to increase the depth of collected data by capturing a more detailed characterization of the study population through tools such as a comprehensive geriatric assessment. So collect more information on the patients who are enrolled on trials. So as I mentioned earlier, the IOM report led to ASCO, the American Society of Clinical Oncology, taking up this issue. It put together a task force to examine the IOM recommendations, and their work culminated in an ASCO statement that was published in the Journal of Clinical Oncology. And ASCO made another set of recommendations, some more detailed strategies on how we might improve the evidence base for this population. And the recommendations really fall into two buckets. So improving the conduct of research, we targeted how we might use clinical trials better to improve the evidence base, as well as how we could use other research designs or existing research infrastructure to generate more evidence on older adults. And then there were some recommendations on improving the research environment. So the ideas included increasing FDA's authority to incentivize or require research involving older adults with cancer, some targeted educational efforts to increase clinicians' recruitment of older adults with trials, and then we thought that journals could do a better job of requiring researchers to report out the age distribution and health risk profiles of people who actually participate on trials. So following the ASCO statement, ASCO partnered with FDA on a public symposium in 2017. And as you'll see here, the sessions were really organized around many of the same themes as the ASCO statement, but we talked about designing clinical trials for older adults, thinking about increasing their enrollment on FDA registration trials, thinking specifically this time about the role of real-world evidence, and then we had a policy session where we looked at what lessons might be learned from what's been done in pediatrics to increase the evidence base, what's been done within the Europe to increase research on older adults, and what levers do payers have to encourage the generation of evidence. So the workshop led to another publication with another set of pretty specific action items and strategies that could be used to expand the evidence base for older adults with cancer. And I'm going to turn it over to Dr. Kleppen to go through these action items in a bit more detail, as well as talk about some of the developments that have happened since the workshop that have been positive for the evidence base supporting this population. Thank you.